Welcome to Youth Diary. Urinary problems of any sort can cause a great deal of discomfort and embarrassment. Today we have Dr. Mohammed Saheed with us. He is an eminent urologist and andrologist. He is working at Sunrise Hospital, Cochin. Doctor, welcome to our show.
Thank you.
In your common practice, what are the commonest problems among youth that you come across?
See, when you ask such a specific question, if it is an adolescent, maybe from 15 years to 20 years, we get urinary tract infections, we can get stones, and we can get genitalia related problems like phimosis, where the foreskin does not come back. Those are the common problems you find. And then congenital anomalies, that is, children are born with these problems of kidneys and ureters. All those problems also present at later ages also.
So doctor, we have some video clippings. Let's have a watch on that.
Hello ma'am, I am Vishnu. I am doing MCA at Ascengist. Ma'am, my doubt is that in last 6 months I have noticed red colored urine twice. Should I see a doctor, or what could be wrong with me?
See, red colored urine does not necessarily mean that it is blood in urine, but then it is very essential that he gets checked this urine for blood cells. So the commonest cause for blood in urine in this age group can be stones, can be urinary infections, or it can be stress related, or when he strains a lot, his bladder may have some contusions or inflammations, and then he may pass red colored urine. Or it may be a totally unrelated condition like kidney disease, medical diseases of kidney like glomerulonephritis.
Some serious illnesses.
So it is essential that he gets his urine checked first to confirm that it is red blood cells, or that is blood seen in urine. And the second thing is that where is the problem, whether it is the kidneys or the bladder or so. So he should have at least a scan or an X-ray done. So it should not be left alone, and he should go and investigate with a doctor.
That means he don't have to wait
No, he doesn't have to, because it's already 2 episodes in the last 6 months. So it's better he gets it checked.
As early as possible.
As early as possible, right.
So we'll go on to the next question.
Hi ma'am, I am Anwar, I am doing MCA. I have doubt, I am getting recurrent urinary tract infection. What should I do?
Actually, he's an engineering student.
From the clipping it appears that he's around 20 years old. So urinary tract infection in a 20-year-old. Again, it may be totally as one episode of urinary tract infection, but in a male child, it requires investigation, because usually it is the female child who gets a recurrent urinary tract infection at this age. So when a male gets an infection at this age, he should get investigated. It may be again urinary tract infection may be because of congenital problems, or it may be due to stones, or it may be due to any other illnesses which may be bacterial colonization of the urinary tract. It may be secondary to some primary condition. So we have to rule out all these conditions either with a urine culture and an ultrasound of the kidneys and the urinary tract.
And doctor, I have a doubt here. Will an improper cleaning of the genital area can it cause urinary tract
Because urinary tract infections are reported to be more common in uncircumcised male child. But that does not necessarily mean that they will get more infections. But it is noted to be less in circumcised children. So it is always necessary that he cleans his genitalia and he cleans his foreskin, and so that unwanted secretions does not collect under his skin. So that's a must in any age group.
And what about dehydration, doctor? Not taking enough water nowadays, at least in this climate.
Because ours is one climate where there is a lot of humidity, so we tend to sweat a lot. And these children may be playing in the sun, and or maybe driving or riding on a bike or walking. So they are bound to have dehydration. So at least 2.5 to 3 liters of fluids every day in summer is necessary.
Okay.
And they should drink according to the color of urine. If the color is deep yellow, he should find that next day he should drink as much water so that his urine is white,
Okay.
like the color of the water he drinks.
Okay.
And whenever he is thirsty, he should have water.
Okay.
Not that he should not have water. So.
And one more doubt here is, what about holding the urine for a long time? I mean, without passing.
Yeah, that
holding
is
it for
also one trend that is more common in female children.
because nowadays it's so common that
Yeah.
in schools and colleges
Yeah,
they
the toilets are not clean.
Okay.
That's one reason why children tend to
They are
use
hesitant
less,
to do it, I know.
utilize the toilet facilities at schools or colleges.
Okay.
So it is better during the interval they go and pass urine for two reasons. One, urine does not collect inside and lead to unwanted complications like stone formation or infections. So that's and then he or she should have enough water so as to have a good cycling of the urinary tract.
Okay. Okay, doctor. Let's see what our next friend has to say.
I'm Mohammed, 23 years old. I have lower back pain and abdominal pain, and my urine has got a bad odor. Could this be a problem?
No, from his question, all this is pointing to a kidney problem. He has a back pain because the kidneys are usually located in the flanks, that's behind. So the pain can come from here till lower abdomen. So radiating pain. That's one reason for the pain. And then he's having bad odor in urine. It may or may not be a urinary tract infection, but unless he gets it checked, so it's better that he sees a urologist and gets at least two investigations. One is to check his urine and find out whether he is getting an infection. And the second thing is why is he getting that pain. So you should have an ultrasound of his abdomen.
I think if my memory is not poor, I remember this guy is suffering from I think for the past 3 or 4 months.
Yeah.
He's been suffering from this problem.
So it's at the earliest he should meet a urologist and solve his problem.
He was telling that he was not getting enough time to go and meet.
Yeah.